This dental phobic patient was referred to me for endodontic treatment of tooth number 28. As you can see, decay approximating the pulp, periapical lucency here, and endodontic retreatment of tooth number 30. As you can see, previous root canal, periapical lucency here, and here. This root canal was done according to the patient in Florida a few years ago. This was approximately 8 months ago when I saw this patient. And here's the date. There was also a buccal sinus tract associated with tooth number 30, and that's the tooth right there, and you can see the sinus tract right there. That's tooth number 28 right here. Here's immediately after we redid the root canal on tooth number 30. As you can see, everything went beautifully, removed the old gutta percha and irrigated three-dimensionally, of course reshaped and re-instrumented and everything. Activated full strength sodium hypochlorite, 6% sodium hypochlorite, sonically and ultrasonically. Look at that beautiful anastomosis between the mesial canals. The apical diameter of the distal canal was over 50, so I placed an MTA plug followed by gutta percha and sealer and temporized the tooth and referred the patient back to his dentist. Okay, so we did all of this in one appointment. This is one appointment endodontic retreatment. And here's the date. Then patient came back and I worked on tooth number 28 and did that root canal again in one appointment, removed the decay, rebuilt the distal wall there, and as you can see, everything went great again. As I said, we did this in one appointment. You can see periapical lucency there. And that's tooth number 30 that we worked on, of course. And here's the date. As you can see, about 8 months ago. And this was just now, today. 8 months post-op of teeth number 28 and number 30. Patient still hasn't gotten teeth number 28 and number 30 permanently restored. 8 months after we worked on these teeth, and we told this patient, we said, cavit, what we used to temporize the teeth with, cavit is only good for 3 weeks. That's a study that shows after 3 weeks, cavit leaks. We told the patient, you have 3 weeks to go back to your dentist. He never did. But as you can see, number 28 healed completely. Look at number 30. Distal periapical lucency healed completely. Mesial, still working on it. It's gotten much, much smaller. And here's the date. Intraorally, the sinus tract is healed completely as well, as you can see. Excellent. I want to talk to you guys a little bit about now a couple of things, a couple of issues that come up sometimes. First issue that comes up sometimes is that cases such as this, teeth with periapical relucencies, you will need to do these in multiple appointments. After the first appointment, when you open the tooth up, for example, in this case, or in this case, when you remove the gutta percha, you need to place intracanal medicament such as calcium hydroxide at least one time, temporize the tooth, bring the patient back maybe a week later, and then complete the root canal. But you will need at least 1 week of calcium hydroxide or calcium hydroxide-like intracanal medicament. And I've posted many videos that I have proven to you guys that I do 99.99% of my root canals like this, or endodontic retreatments like this, in one appointment. And I've shown via post-op, many years, months or years post-op, that I hope that I've proven to you guys that one appointment endodontic treatment or retreatment is as good, maybe even better, with better success rate than multiple. So there's no need for a intracanal medicament in most cases. Intracanal medicaments such as calcium hydroxide. And the only time that I need to place an intracanal medicament such as calcium hydroxide is if the canal continues to ooze purulent discharge, ooze periodontal discharge, then I place calcium hydroxide. Or if I run out of time, so I can't complete in one appointment, then I place calcium hydroxide, temporize the tooth, and have the patient. But in majority of cases, if I can get the canals dry right before obturation, then I can go ahead and do the endodontic treatment or retreatment in one visit. And again, I've proven that to you guys over and over and over and over again. I have over 2,000 cases that I've posted, and I've shown that one appointment is as good. One appointment endodontic treatment or retreatment is as good, maybe even better success rate than multiple appointments. And this was one example. And again, you can see the healing. The other thing, the healing, you can see that. The other thing is that the other issue is that sealer extrusion can cause endodontic failure, or MTA extrusion can cause endodontic failure. And again, I've proven to you guys over and over that that's not the case.